In this video, we will explain different topics of sexual reproduction, the female and male reproductive system, some diseases, sexual diseases, and also we will explain some anti-conceptive methods that will help us to prevent diseases and childbirths.
In Mexico, not everyone knows about sexual transmitted diseases, so that's the reason why we should know and teach other people what to do instead of without using condoms or other barriers to prevent these infections of transmitted sexually.
I'm Dr. Torres and I'm going to explain the female reproductive system. In this system, we have ovaries, the vagina, vulva, uterine tubes, uterus, and some people also consider the mammary glands. Okay, with the female reproductive system, we have what is called the menstrual cycle, where you expose different hormones and regulate the process as the maturation of oocytes, ovulation, and the preparation of the uterus for implantation. When you don't have a baby inside your uterus, then it will expose not the ovaries, but what is inside of it in form of blood, and also the trash that was contained in your uterus.
Good afternoon, my name is Dr. Gallegos, and now we're going to see about the male reproductive system. So the male reproductive system is composed by several pieces, such as the penis, the testicles, the urethra, and the prostate. So the function of this is to launch sperm into a woman's uterus in order to make fertilization. So in this way, sperm is contained in the testicles, goes all the way to the prostate, where it mixes with another fluences, and then goes through the urethra and out the penis. And so the male reproductive system also has a function of, it allows the body to pee. It's connected to the same organs.
Hi, I'm Dr. Cavazos and I'm going to talk about the method of birth control. There are three types of methods. First, we can see the barrier methods. These methods are just to prevent the sperms from entering into the vagina. Then we can saw the intrauterine devices methods. These methods can be made with copper, steel, plastic, and they is from the barrier inside the uterus of the vagina. Then we have the surgical sterilization methods. In man, it's called vasectomy, and it consists of ligated cutting the vast defense of each testicle. And in woman, this sterilization consists of ligature, the section of both oviducts.
I'm gonna talk about the chemical methods, and those are the hormonal methods. They're also known as that. And the most utilized hormonal method are the contraceptives, which are these little pills that contain estrogen that the female, before having any interaction, she consumes it, and it helps prevent the ovaries from developing. And that way, a condom is not needed, but it also helps. But if you only have one chemical method, it's useful, but it's recommended to have several methods being used at the same time.
Now we have the rhythm method that it says that the woman needs to be in a regular period of menstruation. It says that the woman cannot have relations in 3 days before the ovulation, in the ovulation, and 3 days after. If not, she will be pregnant. And the other type of it is the basal temperature method, that it consists that the body temperature increases and the quantity and consistency of cervical mucus change, so it will not be affected.
One of the diseases produced and transmitted sexually is gonorrhea. It is a bacteria that causes this disease. It has no symptom, and 10% out of the men doesn't have symptoms. Out of the men that are infected, and the 50% out of all the women that are infected don't present symptoms. This can affect the childbirth, and also if a child was born with gonorrhea, it can possibly get blind. In the woman, we can have infections that produce bad odors, and also in in men we can see that there is the inflammation of the urethra and the production of pus, and also painful urination. This can be transmitted by oral sex and also vaginal sex and anal. That's all.
It's an sexual infectious disease that is expressed by the act of making sexual actions. And in the case of men, at the start of this disease, it don't have any symptoms until the urethra have an infectious symptom, and when you pee, it starts to burn. And in the case of women, only 70% of them have the disease. Alright, syphilis is a sexual transmitted disease that can also be transmitted through other methods like sharing or donating blood to someone else that blood is infected. That also could harm a lot. And the bacteria on the syphilis infection is called that Treponema pallidum, and it could be spread also by a pregnant mom. When the pregnant mom is at the first stage, she can pass on the syphilis through her fetus and so on.
Llevamos 10 segundos. Yo, stop. Ya.
Stop. Prevention without. No, ya me chingué, güey.
Se me lenguó la traba.
Chlamydia is an. A ver, cállate. A ver.
Ya, o sea,
Otra vez, ya. Ven, serio. Chlamydia is an. Chinga. Sexual. Chlamydia is a sexual.
it's called the menstrual cycle, where you I can't remember.
Dos.
Hey, I'm Dr. Luis Miguel. It will not be affect. Soy un dios.
Alright, I'm gonna talk about the
Man, you look so amazing.
Then you got another button, so you gotta button it up again, like so.
Of course.
Your hoodie on the back, like so. There you go. She can pass on the syphilis through her fetus and so on. Rap, boy!